Hi Lisa, my name's Devin. I'm a level 1 nursing student and I was assigned to your patient in 231 today. Can you give me a report?
It's Shanae O'Connor. She's a 34-year-old female. She's a full code. She is on isolation. Her doctor is Engelbert. She has an allergy to trimethoprim. She presented with a fever of unknown origin. She has chills and a general feeling of just unwell. She has end-stage renal disease, type 1 diabetes, and has been undergoing hemodialysis 3 times a week for a year. She was listed on the transplant list 6 months ago. Her sensations are diminished in her lower legs. She's ANO times 3. Her pain is 4 out of 10. All lobes are clear to auscultation. No adventitious breath sounds. Tachycardia S1, S2. She has +1 edema in lower extremities. Femoral pulse 2 plus bilaterally, and 1 plus pedal pulses in both feet. Her capillary refill is less than 4 seconds. Her abdomen is soft, round, non-tender, and bowel sounds are present in all 4 quadrants. She's on a renal diet with 1,500 ml fluid restriction, and she reports increase in weight gain of 10 pounds and a decrease in appetite. She has a decrease in frequency of urination and volume. She is more concentrated and darker urine. She has no pain, burning, or difficulty voiding, and she voids by herself. Her last output was 200 ml, and we are measuring her input and output, so it's important to get that. Her vitals were, her temp was 100.9, her heart rate was 108, and her blood pressure was 138/78. She has a right median IV, and we will be administering normal saline with her antibiotic today. We are also ruling out bacteremia, or otherwise known as a urinary tract infection.
Okay.
We're waiting on those lab results, though.
Okay, so why specifically is this client receiving this medication?
She presented with an unknown origin fever, so we are treating her with this antibiotic, a broad spectrum antibiotic, to treat that.
Which antibiotic in particular?
She's getting imipenem psilocybin.
Okay, and what action does this medication have on the body?
She is getting this because it's an anti-infective carbapenem. It binds to the bacterial cell wall, resulting in cell death. And she is in renal disease. She has renal disease, so she's receiving it with the psilocybin because psilocybin works by preventing the renal inactivation of the imipenem, which causes, it results in high urinary concentrations.
Okay, and when to do question administering this medication?
If the patient has an allergy to penicillin, also if the, because it's IV piggyback, we want to make sure that the site of the IV is not infiltrated, so no redness, swelling, pain, heat, and that's what we want to make sure that she doesn't have.
Okay, and does it have a therapeutic serum level?
It does not, but we want to keep an eye on a few lab tests, the BUN, AST, ALT, LDH, and the serum alkaline. It may also increase bilirubin and creatinine, and hemoglobin and hematocrit levels may decrease.
Okay, and which vital signs must be monitored when you're giving the med?
You want to look out for the heart rate, blood pressure. These, if aren't increased, can be a sign of anaphylaxis, so you want to keep an eye out on those, but all vital signs are important to watch out for.
Okay, which physiological parameters should be monitored when the med is being administered?
You want to make sure that the patient doesn't already exhibit signs of nausea and vomiting, because this medication can increase those side effects. Also, if the IV site is also infiltrated, such as redness, swelling, pain, you want to make sure that doesn't happen.
Okay, and what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Teach the client about the side effects of the medication, also adverse reactions, and why the patient is getting the medication. You want to tell them why they're receiving it.
Okay, and what about at home? What interventions would be taught for taking the med at home?
This is an IV piggyback, so I don't have any interventions for the patient receiving an IV at home. But if it were to be PO, I would teach the patient the same thing, teaching signs and symptoms of adverse reactions and side effects.
And what are the side effects and potential adverse reactions?
Diarrhea, nausea, vomiting, rash, and some more serious ones are seizures and anaphylaxis.
Okay. How will you know that the medication is effective?
You would look at the patient's vital signs. So, if they have a fever, you want to make sure that the fever has decreased after you administer the medication. Also, the white blood cell count, if it is high, you want to make sure that it's decreased after you administer the medication. That's the way to check to make sure that it is being effective.
Okay. Well, I don't have any more questions, so we can go ahead and give the med.
Okay. Would you like to join?
Sure.
Okay.
We're going to flush it and make sure that it can be given this route before we go ahead and
Shanana? Hi, Miss O'Connor. I have Devin with me today. She's a level 1 nursing student. Is it okay if she comes in?
we can kind of make sure everything's gone smoothly. The patient does have the right to refuse. The patient does not take this drug.
How are you feeling today?
I'm feeling pretty good. I'm kind of hungry, ready for breakfast.
Did you order breakfast already?
I did, yeah.
Okay, good. What'd you order?
I forget.
Oh.
Yeah.
Right before I
I'm still a little sleepy.
while I'm doing this, can you tell
Well,
me?
we are going to be giving you some antibiotics today. It's imipenem, cilastatin. It's a broad spectrum antibiotic to treat your fever.
Okay.
Some side effects that you want to look out for are nausea, vomiting, diarrhea, rash, and you want to let us know if your IV site is red, if it's got some heat, swelling, and pain. Okay?
Okay.
Can I verify the name and date of birth?
Sure.
Go before we go through the
My name is Shanana O'Connor,
Okay.
and I'm 34.
Do you have any allergies?
I do have a sulfa allergy.
And what kind of symptoms or side effects do you have if you receive this medication?
With the sulfa allergies,
Yes.
I kind of forget actually. I don't remember.
Forget.
Yeah.
Okay, I will look in your chart and see what I can find, okay?
Let me just take a look at your bracelet.
And I'm kind of sleepy.
And then you're going to
Sounds
want
okay.
to be administering you some gentamicin. It is an antibiotic. Because you have
First, I'm going to...
signs of infection going on and an elevated white blood count.
Whoop.
Have
That's not
you
what I
ever
wanted
been
just
on
yet.
any type of antibiotic?
We're giving normal saline, sodium chloride. So I have this.
Yeah, I think it gives me like a rash.
Oh, it gives you a rash.
Yeah, that's,
Yeah, I did see that in your chart. Okay.
Some hearing loss or tinnitus.
We are checking sodium chloride. It's continuous, so you'll be getting this fluid all the time. Okay. It's just regular saline same as in the fluid in your body. Nothing new. So it's going at 30 mils an hour. I'm checking the expiration date, the color, no holes in the bag, and it is a 500 milliliter bag. So I have that. I'll be getting my lines. Okay. I'm going to flush your line. Make sure that it's not, that it's patent, and that we can use it.
And we want to make sure when we hook up her IV, it's going to flow right.
And then you want to switch the times forward about halfway. Should be good.
Oh, man.
Right.
Okay. And you want to use
All right.
an alcohol
Find your line
swab so you don't introduce any
on
bacteria into the patient.
this here that comes out at the bottom.
sorry, I'm a lawyer. I'm just.
You're a lawyer?
Yeah.
Oh, okay. How long have you been a lawyer for?
Well, about
Miss
8 years
O'Connor?
now.
8 years. Wow.
Is that okay?
Just have a pretty extensive
We're just going
case
to leave
right
that
now.
there for a second
Oh.
while I get your medication prepared, okay?
Bet it's holding you up being in the hospital. I bet you're in the hospital a lot.
Yeah, it's been
Kind of double check and make
a
sure
rough
there's not
last couple of years for me.
troubles or anything. If there is, kind of flip them out, but it looks like we're good
But,
to
you
go.
know, I'm on the transplant list now,
Yes.
so hopefully I can get one soon.
All right, so we're
Can you state your name and date of birth for me?
Shanana O'Connor, and I'm 34.
Go ahead and connect this.
And do you have any allergies?
I do have the one sulfa allergy.
Make sure everything matches with the mark. So what your name and age.
I can't pronounce it though, it's a mouthful.
Trimethoprim. All right. So she has a right antecubital,
This is for the normal saline with potassium. So you can
and this is continuous. And right now it is
That's so clean, so we'll leave it like that until we go ahead and.
7 o'clock.
Oh, and I see that it turned green.
Yeah, so it's verified.
Oh, okay.
So also again.
So we have
just to
that
double check
ordered.
The second time you want to make sure you have the right medication, which is potassium chloride. Verify this with the mark. If it turned green as you notice, which means we have the right medication. And we scan her
Okay.
so that
So I
lets us
wanna
know
click.
it matches. So this is
Over here.
IV, 125 milliliters per hour. It's going to be
So I'm
continuous.
going to prime
It's going to be IV, which is the right route, and we're giving it
normal saline.
here at 23.59.
Before you start, I want to make sure that the clamp is locked,
So this is our tubing.
so you don't waste any of your
Administer time, whatever time you're going to administer it.
fluids.
We're gonna
And
untap it there.
because
We're gonna untap it here. And this part is sterile.
this
so we
line
make
is
sure
sterile,
Not touch it anywhere. We'll spike our bag.
this is sterile, so don't
I'm actually gonna scan your.
touch it anywhere besides here when we spike.
And another step that we
Okay.
want to do is make sure we label it so they'll know, the next person will know when we hang it,
Okay.
All
when
right.
the next time to change it.
And then you just document, the time you're giving it and
So we're
the
gonna hang this here.
site.
We do have to prime it, so we'll squeeze a little bit in that little boat here. And prime the line just prevents any air bubbles
You want
from
to
getting
make
to
sure that it's about halfway full.
Okay. the very much faster.
All you have to do is squeeze that. All right, we're going to start to prime
So
the
then you're
line.
gonna set this, you channel select, med-surg patient, yes. New patient, so you look at their ID over here, which is 716. 893. And confirm.
Sometimes
and
with
then
bags,
you go to
our lines have a little bit of a problem. You just want to make sure that that's not the case, which it is this case.
guardrail IV fluid.
So I will have to get another line.
And this is the 0.9% normal saline with the 20 potassium. So you put that.
Okay.
Correct? Yes. The rate. So then you look over here and you can find your rate. 125 per hour. 125 per hour, and then going to be infused. There's 1,000 milliliters in here, but you're going to want to put 950, so that way it'll alarm you and you can hang in your bag before it runs dry.
Let me try this just one more time.
And then I will start you on the primer. What's going on?
Trying to get those air bubbles out.
I didn't know you had to look for air bubbles.
Yeah, this prevents it from going into the patient.
And then make sure this
We wanna
piece
make
down
sure we
here
don't
is in
give
there
them
also.
air bubbles and just liquid.
Feedback.
Oh, it looks like it's flowing now.
Alright.
Okay.
And we're unclamped.
So now that it's flowing,
We're good to go.
we can just hang this up here.
Next we have the
In the
gentamicin
meantime-
over here. So then you click on your computer. So what would
All
happen
right.
if there was an air bubble?
And
Patient
now-
ID, so you scan the
Well, it's
one
very
more
dangerous
time.
to the patient if they get an air bubble, causes
We can
embolism,
Scan the
travel and
barcode.
cause major
scan the
problems.
patient for
And the administer time again.
the imipenem, which is a secondary bag.
And the site.
And I have your name and date of birth?
It's Shanana O'Connor and I'm 34.
Okay. And any allergies?
Trimethoprim, sulfamethoxazole.
Okay.
And then you get for this. So when you do a secondary, you're going to want to lower your tone.
And we have our secondary bag. Checking the expiration date.
Insert it in a
The
pump.
correct 500 milligrams every 8 hours. The bag is intact. The fluid is clear. And we're good to go.
I wanna make sure that he's not
God bless you.
Thank you. Excuse me. Make sure I wash my hands. Flu season. Make sure you get your flu shot, Miss O'Connor.
Oh, okay.
All right.
I thought that was my age. I'm not at risk.
Oh, everybody should get vaccinated.
And then scrub it again.
The
So now
flu.
So before you connect this
ID
to,
back.
Oh man, looks like I don't have my secondary line. I'll just go for a minute.
Well, in the meantime, you could just set up your pump for the saline, right?
Oh, you're absolutely right. I figured that. We'll just hook this up.
And then we have a patient ID.
secondary
Number on
here,
here,
and then
number
here
one
it gives you a list of all the drugs. So gentamicin here,
289.
and then again you look at your
And then we
chart.
confirm this is Miss Mardion. Alright, so we have to set this back to our
All right. This is a new patient.
channel select.
Hey, what's up?
Right.
She's getting IV fluids because this is just normal saline potassium.
And
And there's
So you put in the drug amount, which is
normal
80
saline
milligrams of
potassium.
Yeah.
And I believe Mars 20 MEQ, so let me check.
entering the patient's ID. Now we're
Chloride, 20 MEQ.
setting the pump. Now
Just
we
get
have a
something.
basic
And
infusion.
this is right,
We're
yes.
doing
And then the
30
weight, so
mils
we
an
have
hour,
This bag is going to be
And this is our
125 ml per
500
hour.
milliliter bag. So we're gonna do 450.
We have a
That way we have
1,000
enough
ml
time
bag,
to come
but
back
we don't
and
want
start
it to
another
run out
bag.
before our shift is
Cool.
over, before-
And you should be good
Not
to
And
go.
we're gonna start that.
before we
You
have to
kind of check
replace
if you
so we
can see it
put it a
dripping.
little bit
That means
less,
that you're
and I'll
all
go for
set.
950. And then
So
start.
I'm gonna
All right.
Make sure this
take
is
the
like
gloves off, and then you have to label your tubing.
All right, and now we are going to start the secondary bag.
You want to put what time you hung it, that way other
it
nurses
should stay
know
here.
when they have to put up in the line.
Saline plus potassium.
And make sure this is sterile.
Awesome. All right, thanks.
By doing that, you want to make sure your clamp is clamped down. Before you introduce anything into the patient's line again, you want to
And you put the time as well.
Scrub the hub.
yes. And when you're doing this, always hang the primary bag lower than the secondary. Okay.
And then I would document that I did indeed give the medication like I said. If there's any adverse reactions, if there's any issues, you're going to want to document that as well.
And then we will prime this
Here's your
bag
call light right here.
by
If you experience any of those side effects, just
gravity.
let me know.
So
And I also have teaching for you,
Alright.
like I said. It just tells you a little bit more about the drug, why you're getting it, problems that it could cause. Like
And
I
then
said,
we
side
will
effects.
prime the
So just
second
flip
bag.
this over if you'd like. Thank you. You are welcome. Is there
And
anything
it's
else I
in
can
the
get for you? Alright,
Oops.
sounds good. We will leave you be. And let me know if you have any issues, okay? Thank you.
Oh, there it is. And it's 500 milligrams in a 100 milliliter bag.
Yeah, her person again.
Oh.
We did verify her, so.
We have to correct this.
Oh, okay. So you just had to basically start over.
So we want to make sure we chart after we administer the medication. So before I can give her her antibiotics, I want to make sure I see here. Chart that I gave her her normal saline.
500 milligrams in a 50 milliliter bag.
Also, obviously, you check for your doctor's orders. You check for infiltration. That's why we flush the line. And then also I check for
And
the
it's going for
levels
8
to make
hours.
sure that her urine and creatine levels were good to go before we gave it.
Did this information affect your decision to administer the medication?
Yes, if there was an allergy that maybe the doctor possibly missed, you would definitely hold the drug, call a doctor, document it. If the patient refused it, you would also hold the drug and document it.
Okay, now we have our imipenem running. And I brought with me some pamphlets on this medication. So if you want to look that over.
Right.
Do you have any more questions for me? Oh, before I go, I'm going to label this. And it's already labeled with the start date, when to discard, and my initials.
Get this medicine started.
So I've got both of them. You want to change them according to the hospital
We
policy.
did the same thing with the antibiotics.
That's interesting. I didn't know that.
Yeah.
And this is my second
All right.
time checking this against the mark and looking it out there.
We will be back later, okay?
Sounds great. Thank you. I'll look this over.
Okay, great.
All right. Thank you for letting me watch you. I only have a few more questions regarding your med administration.
Okay.
Were there any pertinent pieces of information that you received before administering the med to the client?
Yes, you want to make sure, you can look at any labs, see if any of the labs are like a high white blood cell count. That would indicate giving the medication because the person may have an infection. Also, you want to make sure that they don't have the nausea, the vomiting before you give it because it could increase those effects as well as infiltration at the IV site. You want to make sure that's not happening.
Did any of these things change your decision or affect your decision to administer the medication?
None of these adverse effects happened, so I did administer the medication safely.
And did it affect how you administer the medication?
Nope, I administered it like it should be administered IV piggyback.
Okay. Thank you so much for answering all of my questions. I really feel like I understand this so much better.
Yeah, do you want to come watch me document?
Sure.
Okay.